Hey, it's syndicated radio talk show host, author, singer Al Cole, welcoming you to another edition of People of Distinction, the talk that gives an in-depth view of some of the most dynamic, intelligent, and successful people on the planet. I come from CBS Radio. My shows are nationally syndicated, and I've helped pave the way to treating women, guys too, with the dignity that they deserve, and I treat everybody with dignity, and they treat me with dignity. I do about 300 interviews per year, and I'll tell you, I'm lucky to have the network outlets that I have. Apple's iTunes Radio Network under their professional news talk division, airing CBS shows, Fox News, NPR, BBC, C-SPAN as well. Best talk in the country around the world on Apple's iTunes Radio Network under News Talk. And visit my website, peopleofdistinction.org. And it's a lot to see there, a lot to hear, too. All of my Apple streams, as well as my national, international alliances. People like Ariana Huffington of the Huffington Post, Steven Spielberg. Welcome, Cal, to People of Distinction with Al Cole. It's a pleasure to have you on today. How are you, Cal?
I'm good. It's good to be here, Al.
Now, let's talk about it here. I was laying some of the groundwork to my listeners, and I think they like where it's coming from. Now, carry that baton into Soul Matters, Knowledge to Power, Understanding and Overcoming Addiction. Why'd you write the book in the first place?
I wrote it because I worked in addiction my entire career, and my interns that I supervised said, you've got all this knowledge and that you're dropping on us when we do these group therapy groups. Why don't you write this stuff down? I said, all right, I will. So that's my book. I am passionate about recovery for people who have addictions of all kinds. That might be drug, alcohol. It could be tobacco, eating, gambling, shopping, sex, even iPhone addiction for that matter. I'm just really passionate about helping people with that. I spent my whole career doing it. And in my book, I make sure that people understand that addiction is a disease, as you said, Al. It's not just a lack of moral fiber or a lack of brains. It's a disease. It has symptoms. It's progressive. It's chronic. It's fatal. It's a type of brain disease. And the issue there, as you said, is a lack of power or a loss of control. And that's where the spirituality angle comes in. You have to have a higher power than you to help you do what you can't do. And if you could do it yourself, you'd have done it. So that's where we start. And there's a lot of, I guess I would say, people who look down their nose at folks who have addictions because they think they're just bad people or they're, sloppy or stupid. And that's not true because addicts, on an average, according to research, have a higher IQ than the national average. Mm-hmm. What is called the EQ, the emotional quotient, is lower, and that means how we handle feelings and problems. And that's where drugs and alcohol come in. You can change the way you feel in a hurry. And that's why people get into drug and alcohol stuff, because it's a shortcut way of changing the way you feel. And if we are anything as a culture, it is a shortcut culture of taking care of problems and issues quickly and easily. I mean, we're people who invented microwave ovens and automatic dishwashers and supersonic jets and instant breakfast and instant credit and instant everything. And that's what drug alcohol usage and other addictive agents are all about, is to take care of that, is to change the way we feel in a hurry. And nobody sets out to become addicted to these things. That just happens. I've never had anybody come up to me and say, hey, Cal, I'm 18 years old. Do you think I could become a drug addict by the time I'm 20? I've got a goal. I really want to do that. Mm-hmm. Nobody's ever done that because that would be crazy. And yet it happens. And particularly with young people, the younger you are, the faster you become dependent on something because you haven't gained emotional strength yet by working through a lot of emotional issues, and you have a sense of invincibility when you're young. And that's why the military wants people at 18, 20 years. They don't think they can be killed, and yet they can. So it really works in a hurry with younger people.
Now, you've said a lot there. We're going to break it up into little parts here, and my listeners are really going to catch on. I want to put some focus on what you said that not many other people bring out with addiction. You said that there have been surveys done where people who fall under the pathway of addiction, they've been known to have maybe greater IQs than the norm. And
that's
of
what
course,
research says.
yeah, that's right.
Yeah.
And having some emotional issues, though, the EQ, emotional intelligence quotient, or whatever it might be called,
Right.
maybe that lacks behind. Now, what I'm getting from that, and maybe what my listeners are getting from that, is analysis. Intelligent people look at the world and they say, well, come on. You can't fool me. There's something going on here. There's something going wrong or something. And instead of just dropping out, sometimes they do drop out, or instead of the placards and, the protests, and sometimes they do that, they'll say, I've got to create an alternative reality within me in order to try to deal with this nonsense out there, or some of the nonsense out there, because they can see through it. And then that alternative reality gets them in trouble when they try to deal in reality with other people. Would that be part of the issue here?
It is. I think that people in our culture are always looking for a way to have an alternate reality, something other than they're experiencing. And one of the things that I found out is that among professional people, physicians, clergy, and lawyers have the highest rate of addiction.
Wow.
Now, those are all professions where people exhibit a great deal of control over people's health and their very lives, control over their spiritual life, control over their freedom. And yet these are people who become addicted a lot. And what that says is that it's not about being smart. It's about being healthy and being able to handle feelings. You can be smart as a whip and still be sick as a dog, or you can be dumb as a rock and be healthy as a horse, as far as that goes. When you're talking about a disease, that means it's an equal opportunity kind of thing. Mm-hmm. And people from all walks of life and all socioeconomic backgrounds all can get a disease, just like diabetes or cancer or anything else.
Wow. Hey, we're loving it here, people, on People of Distinction, and Kal is making a lot of sense there. And if you want to order his book, and I think you should, Soul Matters, Knowledge to Power, Understanding and Overcoming Addiction, it's available to you at Amazon, Barnes & Noble, Outskirts Press, and also his website, knowledgetopower.net. I don't want to lose a moment, even though I did. I was really taken by what you said about clergy, lawyers, and some other profession that is physicians. Okay. Oh, well, yeah, they got the supply going there.
Yeah.
All right. Good. Now, I want to ask you, and at any point, throw in whatever you want to throw in too.
Okay.
Supply and demand. Now, with doctors, maybe that's a big thing. They have a lot of supply of this stuff, so they can demand it to their own body when they want to. Maybe with lawyers, too. Lawyers tend to be, pretty influential, and they're in politics and all that stuff. Clergy, that emotional thing, and looking into the spiritual, so it makes sense here. Now, in our society in general, if there were no supply of drugs, after a while, the demand would go down too, I would think. If it ain't there, then after a while, well, people don't crave it as much, and maybe they crave something else. They'll find something to substitute. But supply means something here as well, and it seems that we don't stop the supply. The supply just keeps on coming. Is that a problem too here, as far as you've researched, Kal?
Exactly, Al. One of the things that I found out working in a hospital, as far as the supply and giving out, particularly painkillers, synthetic narcotics. It used to be, when I first started working at the hospital years ago, there was the 4 vital signs that nurses would take, like heart rate, blood pressure, respiration, temperature, and so forth. And then about 25 years ago, maybe, somewhere back in there came to be the 5th vital sign. And the 5th vital sign was pain control. And if you go to a hospital to visit somebody, or if you're in the hospital, the nurses will come in every so many hours and they will say, rate your pain on a scale of 1 to 10, 10 being the worst. What is your pain level right now? If you tell them something 5 or over, I guarantee you're going to get a synthetic narcotic of some kind. Mm-hmm. Because what has happened is that There is a review of hospitals and a review of physicians, and if you don't get a good patient report on these reviews, you don't get as much money from like Medicare or so forth. And so this is a revenue thing, and physicians and hospitals have been sort of strong-armed by this fifth vital sign into giving more and more pain medicine. Therefore, sometimes you end up with doctors becoming what I call a Dr. Feel-Good, somebody who dispenses pain medications for everything. And another factor of this is that I used to do lectures every year for the medical residents. And one year I asked them, by the way, what's the average indebtedness by the time you get out of medical school for your education? And they said, in-state or out-of-state? They knew right away what it was. I said, well, what's in-state? They said, $260,000.
Whoa.
I said, wow, what's out-of-state? $440,000. My conclusion to that was, you better make some money when you got out of medical school, because that's a lot. That's a lot of debt.
Yeah.
And how do you make money in a medical practice? You see a lot of patients. How do you see a lot of patients? Well, you don't do it by sitting down and having an hour discussion with each one about taking history and giving them natural methods of healing. You do it by writing a script and seeing the next person. And that's part of the issue that we have going on now with the opioid crisis. It's just become, quick and easy. And you can't just blame doctors either, because doctors are only doing what we want them to do. As a culture, we want quick fix solutions, and they're basically doing what we want, and they're sort of forced into it with that pain thing too. So it's a real issue right now, and something has to happen with that.
Look at that. Hey, this guy's a wealth of info in terms of the addiction crises in our society, and there are many sort of crises under the general banner of addiction, and we're talking about them all here on People of Distinction with Al Cole. Soul Matters, Knowledge to Power, Understanding and Overcoming Addiction by Kal Rissman, our special guest. And order his book, Amazon, a lot of other places that we've talked about, and we'll talk about again. Now, let's add to that here. With all of these separate crises under addiction that you've talked about, of course, we want to find solutions, and maybe you're one of the guys that has maybe authored something, within your book that has to do with solutions here as well. Now, it's not easy to find solutions, but everybody can contribute at some point, and then makes it easier. What are some of your solutions to these things, Kal?
Yeah, there's a lot of things we can do. One of the things that happens is that addicted persons oftentimes don't get help until it's pretty late, largely because people think, well, there's nothing you can do. They have to hit bottom, and if they don't do that, I can't help them. And one of the things I really encourage people to do is to think about intervention. Think about intervening on people who have an issue, whether it's gambling or drugs or whatever it is. And intervention can take a lot of different forms. It can be a legal intervention. So I know a woman who was so fed up with her husband's drinking that she just called the cops and said, he's out driving. I know what road he's on. Go pick him up. He's driving drunk. And they did. He went before the judge. And a lot of judges now are pretty enlightened about addiction, and they don't just want to fill up the jails. So he said, you are legally ordered into treatment and then follow up. And if you do okay, well, then you'll have, not that much of a problem afterwards. So a legal intervention, there can be a medical intervention. Your physician might say to you, you're eating these Oxycontins like Tic Tacs. This can't continue. You got to stop this. Or for 5 years, I was the nicotine dependency counselor in the hospital. Doctors would order me to see people who use tobacco, and then I would do an assessment. The doctor would come in, and I remember one guy, he said, the doctor sat him down, looked him right in the eye, and he said, I've been your doctor for many years, and I'm trying to keep up with you medically, but I'm going to tell you this. You have early stage COPD, and I cannot keep up with that if you keep smoking. Yeah. I've asked Kal to come in here and help you with this. Will you accept the help? And I said, yeah, I know I've known I need to quit for a long time.
Yeah.
That's a medical intervention. You can have an employer intervention, which is somebody is missing work or they're looking like they're high at work or, smell alcohol or whatever it is. And the employer can do, this is what I call the Godfather offer. It's when the employer goes, do you like your job? Well, then you'll love treatment. And then they volunteer to go, just like that.
Yeah.
Then the other thing is a structured family intervention. If you're going to do that, the easiest way to do it is to hire an intervention specialist. These are people who are certified addiction counselors and certified in interventions, and they know everything to do. They know what treatment centers you can go to if you don't have money or insurance. They know how to run the meeting with the addict to set it up so that everybody writes their letters and expresses their concern. They know all of that's the easiest. You can do it without doing that. And, there's a book that I would recommend also if you just want to do an intervention. It's called Love First from Hazelden Foundation. Mm-hmm. Love First. And that'll walk you through how to do an intervention. The idea in an intervention is to not wait until somebody hits bottom, which could be death. The idea is to bring bottom up till it hits them so that they go into treatment much sooner before they have tragic results. And so, interventions can do that. And if I was an employer, and I recommend this to clergy people too, I would have an intervention specialist on speed dial. I do. Yeah. And it really helps.
Yeah. Hey, and that helps too, what you were just running down there in excellent ways. We congratulate you, Kal, on the wonderful work that you're doing and the research that you've garnered over the years. It's really exemplary. And you've really covered in a spotlight interview the way that we can cover it, minimally with 25, 30 minutes or so, knowledge to power, understanding, and overcoming addiction. But where does the soul matters come in here, brother? Because that's actually the title of your book. Tell us about that aspect.
The title of the book, Knowledge to Power, Understanding Overcoming Addiction, means you may have some knowledge about what to do, that's fine, but you got to get to the power source. Mm-hmm. And the power source is anything that has more power than you do by yourself. Now, I am also a clergy person, so you would expect me to talk about religion right away, but I won't, because what happens is that addicted persons are oftentimes running from religion and have been for a long time. And they may not have any religious background, or they may have had bad religious experiences. So before you run in and say, well, you got to go to church and believe in God, it's a lot better to start out where people can start out. If somebody has no idea of anything religiously, all people are spiritual people, but not all people are religious. So I would say start where you can start with people, and that would be, here you go. Here's a couple things you need to know. There is a higher power than you somewhere in this life, and it's not you. You start there. Mm-hmm. And then the person can say, well, I know my group in treatment has more power together than I do. That's a higher power. I know my AA meetings, NA meetings, GA, CA, whatever, OA meetings have more power together than I do by myself. I know my sponsor gives me more power than I do myself. I know the readings, the inspirational readings that I do give me power. And then eventually they may start looking at something that is working through all of these higher powers, and that could be their version of God, or Allah or Buddha, whatever they call their higher power. Yeah. So I would say you start where people can start. And if people are in, for example, a 12-step program, they're eventually going to get to a better understanding of who their higher power is. But the first thing they need is the surrender of their will to anything that's higher in power than they are. That's where it starts. And they can work their way up from there with more understanding.
Look at that. Hey, this is really great stuff here on People of Distinction with Al Cole. I'm going to make a quick reflection on what Kal has been talking about in the final minutes of the show, and then give the final minute of the show back to Kal to underscore anything else about his book that he wants to. And before I make my reflection on what he was just talking about, I want you to run over to Amazon or Barnes & Noble and order this book, Soul Matters, Knowledge to Power, Understanding, and Overcoming Addiction. You can also order it at Outskirts Press, and by all means, go to his website, knowledgetopower.net. And you are listening to People of Distinction with Al Cole, and I'm going to make this reflection here. You know, Cal was spot on in what he said about the higher powers, power bigger than us, bigger than our own ego. And he started out with, hey, maybe that group around you, even, you know, if you are in that area of the disease of addiction, and you're in a group that is helping you out, and you're helping the group out, they're a higher power than you are. Whoa. Now, that is having our human family involved right now in that higher power development. We don't usually think of it that way. When we think of a higher power, well, immediately we think of the word God. Not a bad place to go. However, some people will say, well, yeah, but your idea of God, Al, might be different from my idea of God. And then, even when we try to approach that higher power, we get confused, and sometimes we get contentious with each other and argumentative and even more. So why not start with the people who we know and honor their power in terms of their knowledge, their understanding, their wisdom? See, this is a People of Distinction way to approach it, and Cal hit it right on the nose that way. We start out with who we know the best, outside of ourselves. We know ourselves, we think, but then we start to get to know others, and we start to understand that they have a level of understanding that can bring our understanding level of ourselves even higher. As we do that, we're trusting. As we trust more, we are friendly towards other people. And as we're friendly, we've broken the ice, people. And when we break the ice, we can even call them friends, maybe even loved ones at that point. And there's nothing like love and friendship to garner that beautiful support that we need as human beings. That is part of the higher power structure right there that Cal was talking about. Then it's easier after that. Once we have friends, once we have loved ones, trusted friends, trusted loved ones, then we can talk about maybe some of those deep things about God and religion and spirituality and everything, and not be so contentious. In fact, even friendly about that. Get it, people? We're talking about ultimate coming together of our human family step by step. And Cal is really a master of that. We congratulate him on his work. And Cal, we give you the last minute to encapsulate your book in any way, fashion, or form that you want to here. Go for it, brother.
The other thing that we didn't talk about is that under the addiction umbrella, there are a couple of other categories. One is codependency, that people who are living with and family members of addicted persons get sick themselves. They get into caretaking of them and, kind of lose their own way. There are also, the third category would be the adult children of addicts, ACOA it's known as in the business. And these are people who are basically survivors. They grew up in dysfunction, and their version of normal is not very normal. My mother was an adult child of an alcoholic, my grandfather being an alcoholic. Most of us who work in this field come at it from some way, either as an addict ourselves or from the family side. I come at it from the family side, which is fine. Anyway, my mother, had a lot of shame issues when she was growing up, and she got into kind of perfectionism and people-pleasing in order to cover up that shame. And that was fine in that she could do a lot of things, but it was difficult for her to relax later in life. She was a caretaker of her dad and her mother, and it's not an accident that she became a nurse later in life, because they're paid to take care of people. Mm-hmm. And one of the things I found about our hospital is that a lot of nurses come out of either codependency or adult children of alcoholics. So those are the other two categories that I talk about a lot in the book. And I would say that this is a disease that is described in the AA Big Book as cunning, baffling, and powerful. And certainly it will always be that. But there is recovery, and a person can do better than they maybe even could have if they had never become addicted. And my book, hopefully, I think it has for many people already, and I'd like to see more. I think it makes the disease less baffling. If you can understand something and you have practical things that you can do to help it, good stuff can happen. So I wish that on everybody out there.
Yes, and so do we here at People of Distinction. And one more time, got to order this book, Soul Matters, Knowledge to Power, Understanding, and Overcoming Addiction, by a special spotlight guest here today on People of Distinction, Kal Rissman. And it's yours at Amazon, Barnes & Noble, and also his website, knowledgetopower.net. And don't forget, he was brought to us by ReadersMagnet. If you got a book you got to move, well, they're your movers. ReadersMagnet.com is where you want to go. Thank you so much, Kal, for being my special spotlight guest here today on People of Distinction with Al Cole. We wish you all the best with your book and your life directions, too. Thank you so much, Kal.
Thank you, Al. I liked it all right.
You did a fine job, and I'll be proud to air this show.